The hollow test is our second active test, and it looks at a client's ability to maintain and generate flexion of the spine. The counterpart of this test is the arch test, which assesses the ability to maintain and generate extension of the spine. When combined, these two skills create midline stability. Without that midline stability, the limbs will struggle to generate leverage and cause a drop in performance. During the hollow test, we'll be looking to answer at least 4 questions. Is there enough strength to maintain the hollow position? Is there enough strength and coordination to create the hollow position from the floor? Is that hollow position constant, or do they struggle? And lastly, is there any pain? There's also 5 secondary questions we need to answer if the client fails a portion of the test. Is there a consistent contraction of the hip flexors and glutes? Are the scapulae drawn downward or shrugged up towards the ears? Are the scapulae's position consistent? Are the knees at full extension? And are the toes pointed away from the body? You won't need any equipment for this test, but you will need a flat surface with enough space for the client to lie down and for you to move around them. Let's have a look at the test. The hollow test is broken down into 2 phases. The first is self-assisted, and it looks at strength. The client will help themselves to create the correct position, and their job is just to hold there for 3 seconds. The second phase is self-generated. It looks at strength, but also coordination. Instead of easing themselves into the position, now they need to create the hollow from the floor and hold it for another 3 seconds. First up is the self-assisted phase. Joe's lying supine on the floor with his feet and knees together and his hands on his chest. From there, he'll bring his legs up and point his toes to the ceiling. If your client's having a hard time getting their legs up, put your arms under their legs and help them into position. Now Joe's going to tuck his chin, put his palms on his legs, and reach up towards his feet. He's going to keep reaching until he's gained as much spinal flexion as possible. As far as the spine is concerned, this is the hollow position, albeit a scaled-back version of it. But in order to test Joe's ability to maintain the position and resist extension, we need to add some leverage. To do that, Joe's going to get tight and slowly lower his legs while keeping his hands in contact with his thighs. As he levels out, his weight begins to shift into his legs, and his torso begins to bear their weight. He'll keep going until his feet are roughly level with his head. Now, don't be alarmed if their weight tips them forward a bit. This is due to the weight of the legs, and it's perfectly normal. It's also not uncommon for the client to straighten their spine as their legs come down. This pulls them out of the hollow position and puts them into a V-sit. So keep an eye out and make sure they don't give up that flex position. Now that Joe's in the hollow position, I'll begin counting off his 3 seconds. During that 3-second hold, I'm answering the first and third questions of the test. Is there enough strength to maintain the hollow position? And is that hollow position constant, or does he struggle? For the first question, I'm looking for change in his hollow position. Is there a partial or complete loss of spinal flexion? Dropping the chest, shoulders, or legs is an indication that the position's been lost. Raising the legs higher is also a bad sign. This is because raising the legs diminishes the amount of leverage they place on the torso, making the position easier to maintain. The legs must remain more or less in the same position during the 3-second count. Lastly, do the knees remain extended? Shortening the legs by bending the knees is another way to minimize leverage. The knees must remain extended to pass the test. The other question is about how Joe maintains the hollow position. Is it held consistently, or is he struggling? I want to see consistency. Struggling, shuddering, and shaking are not indications of failure, but they do demonstrate a lack of coordination, a lack of strength, or both. Assuming the position is held correctly for 3 seconds, it's time for phase 2. If Joe lost position within those 3 seconds, I'd begin working through the secondary questions I mentioned earlier and see if I could coach him to pass. If, after some coaching, he still failed the self-assisted portion of the test, there's no point progressing to the more difficult self-generated assessment. Instead, I'd mark down did not finish for both assessments and move on to the broomstick bow. But for now, let's give him a pass and circle back to those secondary questions later. Right, phase 2, the self-generated hollow. We've looked at whether Joe has the strength to maintain a position of spinal flexion. Now we'll see if he also has the coordination to generate that position from the floor. To do that, Joe will return to the supine starting position. The legs are extended and the toes are reaching away from the body. Pointing the toes is important because it'll make it slightly easier for Joe to keep his glutes on. From there, the arms can go on top of the legs or on the floor alongside the body. The elbows are extended and the palms are facing the floor. Now Joe's going to reach towards his toes and flex his spine to increase his reach. Once he's created as much flexion as possible, he's going to contract his torso, his arms, his legs, and squeeze his butt. Now that he's in the hollow position, I'll begin counting off his 3 seconds. During those 3 seconds, I'm answering the second and third questions of the test. Is there enough strength and coordination to create the hollow position from the floor? And is that hollow position constant, or does he struggle? First, I'm looking at whether he can get into the position at all. Joe's spine needs to be flexed from the thoracic through to the cervical. His shoulders off the ground, his legs raised with knees extended and toes pointed. Then I'm looking for any loss of that position. Does he drop his legs or shoulders? Does he raise his legs or bend his knees? As we discussed earlier, committing those faults makes the movement easier and would result in Joe failing the test. Lastly, I'm looking at how he performs. Is he consistent or struggling? Again, consistency is the aim. Shaking or shuddering isn't failure, but it demonstrates a lack of coordination, strength, or both that need to be addressed in his training program. Joe passes with flying colours, but what does it mean if Joe passes the self-assisted test and fails the self-generated test? The self-assisted test looks at whether Joe has the strength to resist extension of the spine under stress. The self-generated test looks at whether he has the coordination to flex the spine and resist flexion under stress. Failing the second test can be seen as possessing the strength but lacking the coordination. That failure will show up in exercises that involve resisting extension of the spine, like the overhead squat, overhead press, and the pull-up, as well as any other exercise that requires the ribs to remain locked down. Now that we've covered both versions of the hollow test, I'm going to circle back and go over those secondary questions I mentioned earlier. The secondary questions are focused on faults that make the hollow position more difficult than it should be. The aim is to identify those faults, rectify them, and turn a fail into a pass. Let's start with the hips and shoulders and the 3 questions that deal with them. Is there a consistent contraction of the hip flexors and glutes? Are the scapulae drawn downward or shrugged up towards the ears? And is the scapulae's position consistent? The hips and shoulders are an interface between the limbs and the torso, so any failure within those interfaces will destabilize the limbs and increase stress on the torso. The hip flexors and glutes not only stabilize the base of the spine, but the thighs. If you see your client's thighs shuddering up and down during the hollow, ask them to squeeze their butt and thighs as hard as they can during the test. If that doesn't work, palpate the glutes and hip flexors to see if they're contracting consistently. If they're not, make a note of it and address that in their training program. Next is the shoulders, which will break down further into 2 problems. Are the scapulae drawn downward or shrugged up towards the ears? And are the scapulae's position consistent? The lesser of these 2 problems is consistently shrugged shoulders. This destabilizes the shoulder girdle, making it more difficult to stabilize the head and arms. However, because it's consistent, the arms are less likely to move around and increase stress on the torso. The worst of the 2 is an inconsistent scapular position. This keeps all the problems that come with shrugged shoulders, but compounds them by robbing the arms of a consistent anchor point, increasing stress on the torso. In both cases, try to coach them to keep their shoulders drawn down towards their hips. If they can't, address it in their training program. Last are the knees and the feet. Are the knees extended and are the toes pointed away from the body? For the knees, we're not looking at whether they're flexed, as that would simply be a failure to maintain the correct position. What we're looking for is repeated flexion and extension throughout the hold. Flexing the knees effectively shortens the legs and decreases the amount of leverage they place on the hips and torso. Extending them does the opposite. Therefore, repeated flexion and extension of the knees constantly changes the load placed on the torso, and it's difficult for the torso to provide stability while adapting to a load that changes constantly. The solution to this fault is simply keeping the knees extended, though that can be easier said than done. Of course, this could also be the product of inconsistent contraction of the glutes or hip flexors, so be sure to address those questions first, then see if you've still got a problem with the knees. Finally, are the toes pointed away from the body? This simple act makes it easier to keep the knees extended and the glutes contracted. So keep this idea up your sleeve as you address any faults in their position. As you're moving through these secondary questions, remain mindful of time, because there are still more tests to conduct. If you are tight on time, don't be afraid to cut your losses and move to the next test. Lastly, ask whether they experienced any pain during the movement and mark their answer on the screening performer. Before we move on, here's a few key points to keep in mind during the hollow test. First, the client's doing all of the work, so before you start testing them, they'll need a demonstration of the movement. Once you've shown them the movement, coach them through it a couple of times. Second, Pull the client's shirt or singlet taut so your view of their torso isn't obscured by folds or loose material. And avoid doing this test in a jumper or anything else that's thick and baggy. Lastly, have your client empty their lungs before extending and contracting the torso. There's two reasons for this. One, having lungs full of air makes it very difficult to flex the spine. Two, if the client empties their lungs for a second breath during the hold, their torso is going to contract around that empty space and compromise their position. Instead, empty the lungs, then get tight, then breathe into that compressed space. The data you've collected in this test can be compared to the arch test, the squats test, the standing straight arm raise, the glute function test, and the scapular function test. The hollow and arch tests can be considered two sides of the same coin. The hollow test looks at the ability to maintain spinal flexion and resist extension, and the arch test looks at the opposite, maintaining spinal extension and resisting flexion. A client will need both at the same time to create an isometric contraction that stabilizes the spine. For the squats test and standing straight arm raise, you're looking at a failure to keep the ribs locked down and resist extension of the spine. The hollow test teaches deliberate flexion of the spine, and that'll help clients to address that problem. The glute function test looks for a motor fault that compromises glute contraction. Think back to those secondary questions we covered earlier. Failure to contract the glutes will destabilize the legs and increase stress on the torso. So if your client is unable to maintain a consistent glute contraction, use the glute function test to see if a motor fault is contributing to the problem. If it is, address it in your programming. Same again for the scapular function test. It looks for a motor fault that compromises stability of the scapula. Failure to do so will destabilize the arms and increase stress on the torso. If your client's struggling to maintain scapular position during the test, use the scapular function test to see if that motor fault could be contributing to the problem. If it is, address it through programming. This test provides coaches with a few kinesthetic references for other movements. First, how to resist extension of the spine and keep the ribs locked down in movements like the overhead squat, overhead press, and pull-up. Second, the push-up borrows heavily from the hollow position. With the exception of the feet, the core, hips, and lower body extremities should replicate the hollow position when performing a push-up. And lastly, the spine is usually stabilized by an isometric contraction of the anterior and posterior muscles of the torso. This test is about the anterior torso muscles, while the arch test deals with the posterior. Combine the two and you have midline stability. To sum up, the hollow test is our second active test, and it looks at a client's ability to maintain and generate flexion of the spine. The counterpart of this test is the arch test, which assesses the ability to maintain and generate extension of the spine. When combined, these two skills create midline stability. Without that midline stability, the limbs will struggle to generate leverage and cause a drop in performance.